Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Why does my chest hurt when I take a deep breath? Chest pain when taking a deep breath can have several causes. Some reasons for your chest hurting with deep breaths are serious, such as heart attacks or aortic dissections, while others are not emergencies, such as gastroesophageal reflux disease, GERD. /r/n/r/n If you experience chest pain while breathing, contact your healthcare provider or seek medical care, especially if the pain comes on suddenly. /r/n/r/nVerywell. Brianna Gilmartinrnrn/r/n/r/n Chest pain when breathing isn't always an emergency, but it can point to a serious problem. That's why it's a good idea to seek medical care if you experience this symptom, especially if it's severe, ongoing, or occurs with other symptoms. /r/n/r/n Chest pain when breathing can be triggered by several different medical conditions or injuries involving the heart, lungs, or nearby tissues or organs, including the following: /r/n/r/n Other symptoms accompanying chest pain when breathing often point to the underlying cause. They include /r/n/r/n If you have this type of pain, you may only experience it when taking deep breaths, or it may be present all the time but get worse when you take a deep breath. It tends to be sudden, sharp, stabbing, and intense. /r/n/r/n Chest pain when breathing may be caused by heart conditions. That's because the heart lies near and works closely with the lungs. /r/n/r/n Myocardial infarctions happen when blood flow is cut off to a part of the heart muscle. This means the heart isn't getting oxygen, and without prompt treatment, the muscle will start to die. One symptom of a heart attack can be the feeling of chest pain with deep breaths. /r/n/r/n Getting fast treatment for a heart attack helps limit the damage. Anytime you have symptoms that could point to a heart attack, you should get emergency medical help. Common symptoms include /r/n/r/n You may also have /r/n/r/n These symptoms always warrant a call to 911. /r/n/r/n Other heart-related conditions that cause this type of chest pain include the following: /r/n/r/n Some conditions make it hard to breathe while you're lying down. This is called paroxysmal nocturnal dyspnea, PND, and it's common in people with heart failure or chronic obstructive pulmonary disease, COPD. /r/n/r/n The lungs don't have pain receptors. Still, medical conditions involving the lungs can cause pain in several ways. Often, the pain comes from pleurisy, which is irritation of the pleura. /r/n/r/n Pain related to the pleura is called pleuritic chest pain. It can be caused by many different conditions, including some that are cancerous or infectious. /r/n/r/n Cancerous causes of pleurisy include lung cancer, mesothelioma, and malignant pleural effusions. /r/n/r/n Lung cancer. The most common type of lung cancer is lung adenocarcinoma. It and T.O. grow around the edges of the lung near the pleura. /r/n/r/n It's most common in /r/n/r/n The earliest symptom may be pain from cancer reaching the pleura. /r/n/r/n Mesothelioma. Mesothelioma is a type of cancer that arises in the pleura itself. It's most common in people who've been exposed to asbestos. /r/n/r/n You can be exposed to asbestos at work or when remodeling homes or other buildings built before asbestos was banned. /r/n/r/n Malignant Pleural Effusion. Malignant pleural effusions cause fluid to build up in the pleura. The fluid contains cancer cells. Effusions can occur due to lung cancer, breast cancer, or cancers that spread to the lungs. /r/n/r/n Asthma is a chronic lung condition that involves episodes, asthma attacks, including /r/n/r/n. Depending on the type of asthma, it may be triggered by allergies, such as hay fever or physical exertion. Asthma can be well managed with medications, including inhalers, and learning to avoid triggers. /r/n/r/n. Chest pain and trouble breathing during exercise are not considered normal. They may be signs of exercise-induced bronchospasm, EIB, a type of asthma, or a more serious condition like heart disease. /r/n/r/n. Infectious causes of chest pain with breathing include /r/n/r/n. About 18% of people with COVID-19 have chest pain with breathing. It may be due to cardiac complications or infection of the pleura and cause breathing difficulty. Chest pain without difficulty breathing may be a symptom of long COVID. /r/n/r/n. Non-infectious causes of chest pain when breathing include /r/n/r/n. Studies of pleuritic chest pain suggest pulmonary embolism is the most common life-threatening cause. It's the source of pain in 5% to 21% of cases. /r/n/r/n. Conditions involving bony or soft tissue structures in the chest may cause chest pain when breathing. /r/n/r/n. Some of these include /r/n/r/n. Chest pain is one of the most distressing symptoms of panic attacks. Panic attacks are often mistaken for heart attacks due to chest pain symptoms. /r/n/r/n. An older study found that approximately 25% of patients who present to their physician with symptoms of chest pain are ultimately diagnosed with panic disorder. /r/n/r/n. Other common conditions that may cause chest pain when breathing usually cause other symptoms, as well, including /r/n/r/n. Depending on your other symptoms, your healthcare provider may order several tests. These include imaging, blood work, and more. /r/n/r/n. Imaging studies include /r/n/r/n. Blood tests your provider may order include /r/n/r/n. These look for markers of inflammation. They can help to identify autoimmune diseases and other inflammatory conditions. /r/n/r/n. You may also be sent for /r/n/r/n. if taking a deep breath causes your chest pain and you've ruled out potentially dangerous conditions such as a heart attack with a medical professional. There are several steps you can take at home to try and relieve the pain. Tips to relieve the pain include /r/n/r/n. Your healthcare provider may also prescribe you medications to treat the underlying cause or suggest trying other therapeutic options, such as physical therapy, if the cause is musculoskeletal and not improving. /r/n/r/n. Many things can cause chest pain when breathing, including heart conditions, lung conditions, infections, and musculoskeletal problems. /r/n/r/n. Diagnosing the cause of chest pain when breathing can be done using various imaging studies, blood work, and other tests. Without the help of a healthcare professional, it is challenging to determine if the chest pain is due to a non-emergent cause, such as strained muscles, or a medical emergency, such as a heart attack. /r/n/r/n. Err on the side of caution and seek medical care if you experience chest pain. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.